Welcome to News Mongolia, where we bring you the latest stories and updates from across the nation and beyond. I'm Batsirin Namshar. On News Mongolia today, the Thank You Nurses 2025 consultative meeting was held at the State Palace. Domestic trade sales revenue reached 14.1 trillion MNT in the first quarter of 2025. Over 160 people a year lose their lives to cervical cancer in Mongolia. For the news, stay tuned. Under the auspices of the President of Mongolia, Khurelsukh, the Thank You Nurses 2025 consultative meeting took place at the State Palace on May 12th. The event was held in honor of International Nurses Day. During the meeting, President Khurelsukh expressed his gratitude to nurses, healthcare professionals, and invited guests. He emphasized the vital role of nurses in protecting public health, preventing illness, and aiding patient recovery. The president noted that the government has significantly invested in the nursing sector, bringing salaries up to 2 times higher compared to 2019 and launching additional incentives for those working in rural or high-pressure environments in 2024. Mongolia has more than 15,000 nurses, making up 22% of the country's healthcare workforce. However, the number of nurses per 1,000 people is just 4.2, less than half the global average. Statistics show that nearly half of the nurses trained over the past 4 years are no longer working as nurses. Scholarships will be provided to nursing students, and starting this autumn, a nursing training, research and healthcare services center will open in Arhanga province. Construction of the Nursing Education and Research Center has commenced at the Mongolian National University of Medical Sciences. The center will support the professional development, continuous learning, and research endeavors of nurses. As of today, there are over 68,000 healthcare workers in Mongolia's healthcare sector, with nurses making up 22% of the workforce. Thanks to our collaborative programs, several key policies are being implemented in the healthcare sector. One of the main initiatives focuses on disease prevention and early diagnosis, starting with children, the future of Mongolia, and tailoring programs to suit the psychological characteristics of each age group. In particular, early screenings for common childhood conditions such as eye, dental, and heart diseases have been conducted among the first-grade students in general education schools. More than 90% of the first graders in Ulaanbaatar have been screened, with over 13,000 children placed under medical monitoring and receiving necessary treatment. This program has been expanded and launched in rural areas since the end of April. The President emphasized the importance of the sector's collaboration and participation in implementing the national Healthy Mongol campaign. The consultative meeting included a panel discussion on the role of nurses in economic and social development and presentations on current health sector policies and personal development of nurses. This year's International Nurses Day theme was Our Nurses, Our Future. Caring for nurses strengthens economies. Domestic trade sales revenue in Mongolia reached 14.1 trillion MNT in the first quarter of 2025, marking an increase of 54 billion MNT from the previous year. Food products accounted for 23.5% of sales, while non-food products made up the largest share at 76.5%. Despite an increase in food sales, non-food product sales saw a decline, driven primarily by decreases in wholesale trade and the retail sales of pharmaceuticals and hygiene items.
In the first quarter of 2025, Mongolia's domestic trade sales revenue reached 14.1 trillion MNT. This represents an increase of 54 billion MNT compared to the same period in 2024. Food products made up 23.5% of sales, and 76.5% were non-food products. Food product sales amounted to 3.3 trillion MNT, an increase of 335.3 billion MNT compared to the same period in 2024. Non-food product sales totaled 10.8 trillion MNT, a decrease of 281.3 billion MNT from the previous year. The decline in non-food product sales was influenced by 117.2 billion MNT drop in wholesale trade conducted on a contractual or payment basis and a 58.8 billion MNT decline in retail sales of pharmaceuticals, cosmetics, and hygiene products at specialized stores. In terms of market share, 42.9% of sales revenue in the first quarter of 2025 came from wholesale trade, while 57.1% was attributed to retail trade.
In Mongolia, cervical cancer ranks as the second most common cancer affecting women. According to medical experts, over 4,000 women are diagnosed with cervical cancer annually, and more than 160 women lose their lives to the disease each year. Despite these alarming figures, specialists emphasize that cervical cancer is a preventable and fully treatable illness when detected early.
The primary cause of cervical cancer is the human papilloma virus, which is most commonly transmitted through sexual contact. In many cases, the infection shows no symptoms during its early stages. Regular screening and early detection are the most effective ways to prevent cervical cancer. Doctors note that many people tend to seek medical help only after symptoms appear. However, early screening plays a critical role in prevention. Oyunder, a cervical cancer survivor, shared that she was diagnosed in 2019. Depending on a person's immune system, it's possible not to show symptoms or get sick, but everyone has the ability to prevent disease. Especially when it comes to cancer, although it's a serious illness, it can be completely cured. More importantly, it cannot be fully prevented. That's why we need to keep ourselves with health knowledge and pay attention to educating our children to become health conscious. In 2024, 521 women in Mongolia were diagnosed with cervical cancer. Over 60% of them were diagnosed at an early stage, while around 40% were diagnosed at an advanced stage. The World Health Organization believes that no woman should die from cervical cancer as HPV infection is preventable. Since it's recommended to undergo preventive screening every 3 years after the age of 30, I regularly get tested. The uterus is a silent organ, so even if there's something wrong, symptoms don't show right away. That's why I believe it's important to participate in early detection screenings and get tested, because even if you're sick, early diagnosis gives you the chance to be treated. The main cause of cervical cancer is 14 high-risk types of HPV. We are preparing to introduce testing to detect this virus as part of early screening. Preparations are already underway, and we are getting ready to start in Hanwal district in Ulaanbaatar. In 2023, Mongolia amended its law on immunization to include 3 new vaccines in the national immunization schedule. One is the HPV vaccine, which 145 countries have introduced to their immunization programs. In Mongolia, children are now being vaccinated starting at the age of 11 to prevent HPV-related cancers.
Now let's take a look at Mongolia's current affairs.
On May 9th, the chairperson of Parliament's standing committees on social policy, education, culture, science, and sports, members of Parliament Inknasan Lota and Ondram Chimbat met with a World Bank delegation led by Alberto Rodriguez, the regional director for human development in East Asia and the Pacific. Member of Parliament Ignace Lota highlighted the successful collaboration between Mongolia and the World Bank in the health and social sectors, particularly projects strengthening emergency medical services in rural areas. Member of Parliament Ondram Chimbat emphasized the committee's efforts to implement the education law and shared plans to designate 2026 the year to support education with UNICEF, focusing on new schools in remote areas and infrastructure improvements. Member of Parliament Zulfar stressed the importance of refining the social insurance system and expanding performance-based financing from health to education. He also noted the government's focus on energy and infrastructure development. Regional Director Alberto Rodriguez emphasized the World Bank's commitment to investing in people and supporting Mongolia's social sector development. He expressed readiness to assist the governments of Mongolia in ensuring equitable access to quality education for all children, regardless of location. The meeting was also attended by Taehyun Lee, World Bank country representative for Mongolia, Christian Adio, Education Manager for East Asia and the Pacific, Maria Anna Lugo, Human Development Program Leader for the People's Republic of China, Mongolia and the Republic of Korea, and health and education experts.
You're watching News Mongolia. Now let's take a look at the currency exchange rates provided by Mongol Bank. Now let's take a look at international news from our partner agencies. Gaza is on the verge of famine, food security experts warn, as nearly 500,000 Palestinians face starvation and another million struggles to find enough to eat. With Israel's blockade and military operations ongoing, families are turning to desperate survival tactics. Aid groups say the situation is rapidly deteriorating, with food and water becoming almost impossible to access.
For the past 10 weeks, Israel has blocked all deliveries of food, medicine, shelter, and other essential goods into Gaza, while continuing its airstrikes and ground operations. Gaza, home to about 2.3 million people, has become almost entirely dependent on humanitarian aid, as Israel's extended military campaign has destroyed most of the region's food production capacity. The office of Israeli Prime Minister Benjamin Netanyahu did not comment, but the Israeli army claims that sufficient aid entered Gaza during a ceasefire that ended in March.
How long are we going to continue to do a calm down? That's unacceptable. We need to be able to get back to people with the right level of assistance and to go to them. We need to serve people where they are. They are not able to move. They can't afford to actually have transport. They can't afford to go to farm markets because they might be attacked going to this market. They might face gangs. They might face bombs. We need to serve people where they are.
Israel maintains the blockade to pressure Hamas into releasing hostages and says it won't allow aid until it controls the distribution system, accusing Hamas of diverting supplies. The U.S. says it is working on a new mechanism for aid delivery, but has not provided a timeline. The United Nations, meanwhile, refuses to participate in the proposed system, denying widespread aid diversion and arguing that the plan would not meet Gaza's humanitarian needs. Monday's report concluded that any progress made during the brief ceasefire has been lost. It warns that almost the entire population of Gaza now suffers from severe hunger due to ongoing conflict, destroyed infrastructure, and restricted aid access.
Well, that's all for today. Thank you for staying with us. We'll see you tomorrow with more news and updates. Goodbye.